Good evening, everyone. A warm welcome to this evening 7:30 p.m. Acupepper Therapy Day 11 session. Today is Saturday, 15th June 2024, 7:30 p.m. So let us begin our session. Good evening, sir. We'll first start with questions, sir.
Yeah, last week questions.
Yes, sir. One second.
What happened? Hindu ma'am has got the questions.
Yeah, she shared in one
Even I do have.
Yes, sir. One second. I'll just get it. I saw somewhere just now, but I'm not seeing it now. Yeah, got it.
Got it?
Yes, sir. Test paper 11.
Yeah.
Class dated 8/6/2024. So now we are going to discuss the questionnaire of test paper 11. First question is, sir, is kidney channel centrifugal?
Kidney is what is happening. It is coming in, isn't it?
Yeah.
So coming in. So it is centripetal. Okay. So it is coming in. So it is taking the energy from outside. Okay. Right.
Second question, how many points are there in kidney channel?
How many are there? 27. Right?
Right.
27 points are there. It ends in the first and second rib bone.
Third question, where does kidney channel start?
But it is starting just below the second toe and big toe, that is in between. So there will be a W kind of a thing. So there at the center it starts. It doesn't start at the nail base. The only in channel which doesn't start or end at the nail base. Yeah.
Fourth question, sir. Which point in kidney channel will you use for numbness in food?
Numbness. Numbness is why. The numbness is mainly because the blood flow, blood circulation is not all right. Is not all right. So especially all below the knee points, they are all based on water only. So you have any problem below the knee, main thing is water. Okay. So what is the fire point in water? It is K2. So K2 is the point which you use for numbness in toes and other things.
Okay, sir. Next question. What is the horary point in kidney meridian? When is it useful?
Horary means what? Kidney meridian is water. So water. So it is K10. K10 is just behind the knees where the two nerves are there. Okay. That is the point. Two nerves. It will be center of the two nerves. It is K10. It is mainly used in obesity. Not only obesity, even for knee pain and other things you can use, but mainly because too much of water is there. That is why obese. So it is used for obesity. Okay.
Okay, sixth question. Which point will you select for toothache?
Toothache. Toothache, which point you select? Tooth. Why tooth is aching? It is not because of the tooth. It's because of the gums. So gums means which energy? Earth energy. So from water, you have to give strength to earth energy. So it is K3 point.
Okay, sir. Seventh question. K1 point, uses and its benefits.
Which one? K1.
K1.
K1, yeah, that is the most useful point, which is actually energizes you. Your chi is stored in your kidneys. Okay, the energy. So K1, it really it boosts up to chi, and any infection, anything in the water channel or any blockage in the water channel, anything, K1, even for general energy boost, you can think of K1. That's why you have to wash your feet as much as you can, as many times as you can. Okay.
Okay. Next, eighth question, K22 point and its implications.
K22 is the point where the it is just bit, just about 2 inches below the nipple. Okay, it is on the whatever you call on the chest, right? So there, especially women, they wear the inner garments and it is pressed over there. If it is pressed, then the water energy will not go easily. So it splashes. That is why your PC1, it starts paining, because water is to balance with fire, doesn't get balanced. That is why you will get your once the PC gets affected, your upper arm swelling, and then swelling in the PC1, pain in the PC1. All these problems they start. Even for breast cancer also, it happens. So you have to be careful. Don't wear the inner garment all through. Okay.
Yes. Ninth question, which point will you select for knee pain in kidney channel?
So knee pain, kidney channel, it is K10. K10 only you will select, because water. So you can use K10 knee pain. You can also use K1.
10th question, how do you control cough in kidney channel?
So you have the 27, K27 point. You just press that K27 point. That is why whenever you cough, you hold it like this when you cough. So when it is a natural thing, because once you press both the K27 points, the cough will get.
Okay, sir. Thank you so much for answering all these questions. Now the session goes to you, sir. Take over. Thank you. Good evening, sir.
Good evening. Okay, now today we are going to deal with the longest channel, that is urinary bladder. One of the unique, very important. Don't miss out anything today, whatever I am telling. Very important UV channel. It is not only, I mean, it cures. You can even identify where exactly the problem in your body. So many things are there. It is the channels, they go round, 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 and round. And what is exhibited outside is below the skin. So in that way, it has got 67 points. 67 points. So one of the longest, and it does so many things. Actually, urinary bladder, people think what this is, just it is storing only urine. What is so important? But that energy, that channel is absolutely fantastic. Absolutely fantastic. It's too good. Okay. Now we go to the So 67, it is a yang channel. Yang channel means what? Hot. It is supposed to be hot. And it is water channel. But we take so much of water unnecessarily. So this UV channel, it gets chilled. It gets chilled. You just put some water in a bottle and put it in a freezer. What happens? It becomes hard, isn't it? It becomes hard. It expands. It becomes hard. So where will be the movement of the energy? Movement of the energy gets affected. Gets affected. That is why I have been telling you, don't unnecessarily don't drink water. Don't drink. Sip water when you are thirsty. That's all. But for your water requirement, you have a lot of juice that is in the form of food. Anything you add to water, it becomes food. Take it in that way. You see, in Kerala and all, they used to put some root and this for water. They don't give you plain water because you people, you just going on gulping. So they thought better we put something into the water so that it becomes converted to food, not plain water. Okay. So where does it originate? It originates from the inner corner of the eye. It originates from the inner corner here, just below the eyebrow, on the closer to the base of the nose. It starts from there. People who have been having water problems and all, you press that will pain, sinus pain, everything. Everything, it starts there. That is the first base point, basic. And once it gets frozen, there is an inflammation inside, so eyesight might also get affected. Okay. So it rises up, runs parallel to the central line of the body, two of them runs parallel. Across the forehead, goes around the head, on the back. See, that is why the UV channel is supposed to be hot. You chill it. That is why hair fall starts. Somebody was asking the question yesterday, how about hair fall? That is why, because of the UV channel. So you see the receding of the hair starts exactly at the UV channel pathway. It starts here, starts from there. Why the hair should lose? You see, you should lose your hair. Because heat is required. Because you made it chill. So it wants to directly absorb the heat from outside. The hair is obstructing it. Okay. So it starts falling. The hair fall starts there. Okay. Especially for male pattern baldness. All this in the start over there. Okay. And you might ask why it is not happening for women. Oh, they should also have, if there is a urinary chill problem. Men are basically hot, yang. Women are basically yin. That's why it doesn't happen. That's why it doesn't. Okay. So at the back of the neck, hair crease divides into two branches. It becomes four. Two on each side. One branch runs down parallel to real central line at, okay. All these things, it is quite a long story. They run parallel real line. So what we will do is, we will watch the video, then we can discuss. I think that will be better. This is the one, the at the inside, the eye goes there, comes down below the neck, hat this thing. It's there. It divides into four. This is two. It's coming down straight down. Okay, up to the sacrum. Then this one. Okay, then it goes up to the back side of the knee. See that point, that is UB40. Okay, then the other branch also goes like that on the other side. Okay, comes down and then goes round. And it goes round, then again it passes through 40, then it comes around the outer ankle, then comes down and ends at the little toe, that is UB67. Wonderful point, UB67. Okay, so this is what it is. See, here, see, this is the where the UB water, no, it goes like that around your bumps, your buttocks. Okay, that is why you find a lot of people have buttocks, big buttocks. We used to call MBBS, member of Big Buttock Society. Okay, so they used to have a big one, very big one, huge, because of water accumulation, because of this freezing of the UB channel. Okay, that's why it becomes very big. Okay, I will play it once again. Watch, this is 1, UB channel 1. Okay, goes round. See, this is where I was telling you receding of hairline. See, it starts generally here. It starts, you must have seen all this area, there will be hair loss because the channel, which is supposed to be hot, gets chilled. Okay. Comes down like that. Okay. Then goes there. This point you remember. This point. This point. This is the one. Actually, I'm going to talk to you about back shoe points. Okay. Back shoe points. So this is 13. Okay, 13, 14, 15, each one just one chone behind each other. Okay, up to 27 we have important back shoe points. And I will tell you about that. Okay, it goes like that, down below, like this. So this is how it is. You have on this side it goes, of course on the other side also it goes. That is why the buttock becomes big, because it is frozen. Because when you put water in freezer, it's frozen, so it enlarges. Likewise, here the cells they are all enlarged. They're all enlarged. Okay. It comes down here. These are all good points are there. Then you have this. This is this point here. This is UB60. UB60. Okay. Fire point, right? So now we will run through this. So again, it runs down vertically to the cockle. From there to the joint of thigh, it runs down. So central line of the knee. Other branch run down 3 chun parallel to the rear central line. Okay. The first one, it is 1.5. The first one, 1.5 chun. The other one is 3 chun parallel. Okay. But as long range meets the inner branch at the back of the leg at posterior knee crease. Then it continues along the cough muscle to the, that is why, whenever you have a cough muscle problem, pain in the cough muscle, not only that it is fire. Why? It is supposed to be the second heart. Supposed to be the second heart. But this UB, it is running through the cough muscle. It is chilled. Actually, cough is your second heart. Heart means fire. It gets chilled. It gets enlarged. So that is the reason why you get cough muscle pain. Okay. Then it goes to outer knee joint, runs along the border of the color separation of the skin, and it ends at 0.1 tune above the little toe nail base line. Okay, that is 67. 67. 67 means should be air, because the yang channel, they start or end with air. So it is going out, so it is centrifugal. Okay, right? So I think it's wrongly depicted. We will start from 67. What are the points here? They are UB, air is UB 67, water is UB 66, wood is 65, fire is 60, and the earth is 40. Okay. So you come down from 40, 60, 65, 66, and 67. Okay. So we will start from 67. So 67 is air. Okay, 67 is air. It is 0.1 tune from the outer corner nail base of the little toe. Just 0.1 tune down below this. What does it connect? It connects air and water. Air and water. It is a famous point for normal delivery. Normal delivery. I've done a lot of cases, but one should have, if they are undergone cesarean, the first delivery, second it might be difficult, but they should be also, tuned to nature. Should not be taken so much of medicine, so much of. See, pregnancy is something, where it is a boon for ladies. It cleanses. It cleanses every time you become pregnant. Your body is cleansed. But you think that, because the waste is going out, you start vomiting. You start vomiting in the first 3 months. Why you start vomiting? Because the liver is getting cleansed. The liver is getting cleansed. So the new life or new baby, so whenever you want to go to your new house, or when you get into your, you clean up all the old things and then you make everything new, isn't it? Likewise, the child wants the body to be cleaned. So the first thing is, liver. That is why you get vomiting. What is the taste of the liver? It is sour. You like all sour things the first 3 months. If that is getting extended, that means your liver is a bit bad. But it will extend, the vomit will be coming. But you run to the doctor and say, no, vomiting has not stopped, this is happening, that is happening. Leave it. Just leave it to nature. It will ask. Then your taste will differ. Suddenly you like start sweet. That means what? That your earth is getting clean. The stomach, spleen, they are getting cleansed. Some people will like bitter. Means what? That means your heart is getting cleansed. Some people will like salt. Kidney is getting cleansed. So whatever you like, whatever taste you like, you take that. It is getting cleansed. And sometimes an abortion might happen, or some problem is there where this is twisted, that is happening, this is happening. It is all mostly because of medicines, whatever you are taking. But what is happening is, suppose if the womb or something, if this thing is not properly developing, so abortion will take. That is nature. Doesn't want the deformed child to be born. So it is an abortion will happen. It is automatic. There is nothing very great, in having it is a normal thing. I remember my grandmother, my father's mother, they had about 14 children. Out of 14, 3 died. 11 was there. She was hale and healthy till 93 or something. No problem. Never had any problem. Any problem in uterus of that and this. Nothing. Because every childbirth, the entire body is getting cleansed. You just listen to the body. Just listen to what the body wants. Body is telling you. Body is talking to you. The problem is when something bad is happening, since some uneasiness comes, we think, okay, the body has gone for a fix. No, the body is cleansing. If you are vomiting, when you vomit, why do you vomit? Because the thing which is not acceptable to the body is being thrown out. That is all. You think vomiting is a big problem. So immediately take him, then you put a vomit. The toxin which is getting out has been contained within itself. Then one disease becomes another. This is the main problem. So this UB67 point is a wonderful point, especially the month of 7th, 8th month. You start giving this point. You can give it every day, there is no problem. There will be a normal delivery. Actually, it happened to my own daughter-in-law. So she was, this thing was getting delayed from this one. The doctor said, we will do a cesarean. So we said, no, we are not doing a cesarean. Let it take its time. How can you decide? How do you know when exactly it got fertilized? You are just telling from the first missed period. How can you know whether it got on the first day of this one or on towards the end? How will you know? Okay, 27 days. Out of 7 days, first 7 days, there cannot be any conception. Last 3 days, there cannot be, but it can happen also. So how do you know of the 24 days, which day it got fertilized? You don't know. It might get delayed. Then she started, she is a very regular, you can even call her as my devotee. So she started pressing the 67 point. What a beautiful child, beautiful girl child. This happened in 2010, 11, yeah, 2010. Not only that, I have told many people, all of them got into normal delivery. But you take the guidance, you require the guidance. Not that, okay, it's not required, I will do it. A lot of people, a lot of acupuncturists, they said normal, they get carried away. Okay, should not. You have the medical attention, but same time, don't just like that, don't listen. Give time. Okay. So this is UB67 point. Here, this water is the gynec. Water is taking care of it. And air is the prana. Air is the prana what the child gets. Okay, so that is UB67 point. It is an excellent point. Remember, for normal delivery or in water and air problem, because we saw case 7. So UB67 also can be used for any problem in the lung and other things, water in the lungs, other things it can be used, but mainly for this. Okay, then you have UB66. It is water. It is a horror point. Water on water. So any problem relating to water, even obesity, all these things you can use UB66, but not generally used. Not generally used. Maybe you can find out certain usage. It is located at the lateral end of the little toe, at the junction of skin separation. So there will be a small mound will be there here in this point. Just before that is water, 66. After that is 65. After that is 65. That is wood. Color separation. Wonderful point. Any problem, any infection, UB65, your this one, urinary tract infection, UB65, nothing like it. Nothing. It is absolutely too good. Or any infection in your what do you call related to what do you call urinary tract, as well as your channel, even eye problem. Eye, there is an infection. You can use this UB65. Wherever the channel is running, whatever infections you have, whatever these things you have, UB65 can be go to just check where it is running, and you can have all, even backbone. So there are some problems in the seminal fluid. UB65 is very excellent. And not only that, pain in the back, UB65. Okay, pain in the cough muscle, UB60. Anywhere, wherever there is pain or any blockage, anywhere, any swelling, UB65. The channel, or wherever the blockage is there, use UB60. For pain, for infection, excellent point. UB65 is an excellent point. So many are there. You can just imagine, that's all. Okay, that is wood. Then UB60. This is the fire point. This also can be used for numbness and other things, mainly for hair fall. It's absolutely beautiful point for hair fall. So it is UB60 because it is generating heat. If a lot of people have pain in that point, okay, my ankle, sprain and this and that, mainly because you are drinking too much of water. Mainly because of that, it's getting chilled. The channel which is supposed to be hot is getting chilled. It's mainly because. So use this BL60 point for hair and other things. It is actually, you have the knee and you have the last tendon, heel joint tendon. That is called Achilles tendon. So between the two, in that this one, on the opposite side, is K3. On the opposite side is K3. This is on the outer side. Okay. On the inner side, it is K3. So that's where you will find earth and fire. Earth and fire. Can I even hold it like this? K3 as well as BL60, that is UB60. Okay. That is fire. Then you have UB40. Wonderful point. Any problem in your leg below the knee, use this point. Use this point because mostly it is because this is earth. Just behind the knee. Just behind it. Okay, even for your knee pain, you can use this. Any pain or any discomfort below the knee, use this. And it is also used for prostate enlargement. For many people, they have the prostate enlargement because it is not in prostate gland is not in its position. So this UB40 will help in a very big way. UB40. Okay, right? Pain, anything to do with that. Let just below the knee for any problem, you can use this BL40 as an additional point. Additional point. Okay. Okay, so we talked about air, UB67, water, 67 is at the outer nail base, 0.1 tune of the little toe. Then water, that is UB66, just at the bottom of the coccyx. What is the bone? I forgot the name. And then this wood is on above 65, fire in the ankle 60, earth behind the knee 40. Okay, so these are the main points. Remember 67, 66, 65, 60, and 40. Okay. Then we have some special points. Because I told you, for normal delivery, UB60 also I told you, stop hair fall. UB40 I told you, for any ailments below the knee. And there is a point UB56. Where it comes is, I will show you in the this is the point, UB56. Okay, this is UB60. This is UB56. Right? Just at the middle of the calf. This will, if somebody has got piles or hemorrhoids, whatever it is, it will go off in no time. Just press this point. This is a unique, very unique point. I don't know how it works, but it works. It works. This is UB56 point. Okay. Then I'm going to tell you something very, very important. So this is where the inner, well, there is 1.5 tune from the central line. Okay, you have these points. They are BL, starts from BL12, 13, 14, 15. Each one of them just one tune below. If you bend your neck, so there will be a mount over there. There will be a mount. Okay, just one tune, that is 12. Okay, this is the point. This is the mount. 2, Then you have one tune below 13, 14, 15, 16, 17, 18, 19, 20, like that. So down below, if you come, this is BL 23. It is just at the hip line. You have the hip coming in, it will be like that. So just around the hip line. This is BL 23. Okay. Then you have 24, 26. We are concerned up to 27. What is this? These are all the points indicating if you press these points, you can see this UB13. If there is any pain, then that means your lungs are affected. It will tell you, there's no jokes. You can identify which part of your body is affected, where exactly there is an energy problem. When there is a pain in UB13, it is lungs. When there is a pain in UB14, it is pericardium. Just one tune. UB15, it is heart. So if there is a pain in 14 and 15 or 15, that means there is an energy imbalance in your heart. You can correct it. You can easily identify which energy there is a problem. And UB18, 16, 17, there is nothing. 18, it is liver. 19, it is gallbladder. If you have any gallbladder stones or anything, then it will pain in 19. UB19, it will pain. Then 20, if you have problem in the spleen, UB20 will pain. 21, stomach. 22, triple warmer. And 23, kidney. I tell you, I have removed a lot of this kidney stones just by pressing this UB23. That is, you press, some people might have taken a scan or something. You press it, put both your thumb, just at this 1.5 tune from the center. We press it. If it pains more on the right side, that means the right kidney, there is a stone. Left to left stone. Press it. Just rotate it. Just press it. Then leave it. Within no time, this one will get washed off. When I was doing in Malaysia, it happened. So I gave him, that fellow had stone, suffering from stone for a long time. I gave him the point. Even before he could get to his house, the stone went off. With a little bit of pain, but it went off. So that is what it is. It's a beautiful point. UB23. And then you have any problem in large intestine, UB25 will pain. Small intestine, UB27 and UB28, urinary bladder. Urinary bladder. So this is what it is. You can, if you want, you can take a picture of the click of this, or you can see in my notes. Okay. Right? Beautiful, absolutely beautiful. This you will not find it in anybody. You can identify, like how you are scanning or whatever it is. Absolutely too good. Absolutely too. Whenever you have a doubt, which is where there is a problem, press these points and then find out. Okay. So urinary bladder channel is absolutely a wonderful channel. Too good. So you can cure most of the disease. That is why if people undergo a leg massage, this one, mainly because what you are doing, or back massage, what you are doing there is, you are really releasing the blocked channel. Back massage. You undergo back, massage. It's mainly because you release that channel. So leg massage, back massage, all these things are really good, and you can undergo massages. It's good. So it will relieve you out of a lot of pain and whatnot. Okay. Then more point what I want to tell you. So this is 1.5 chun. This is 3 chun. Distance is 3 chun. Okay. And if you want to, whenever you want to massage, please remember, do it from top to bottom, the flow of the channel. But generally people do massage both ways, then up and down. No, do it from top to bottom. That is, whenever you have a back massage, that is from a smaller number to a larger number. Here you take, whenever you do it, start from UB12 and then go down like that. And then you can even go down. Whenever you do it, generally I suggest UB40 to, I generally suggest massage from UB40. This is the one. Okay, UB40. This is the one, UB40. From here, you do it only this way. Don't do it up. Because the flow of the channel, do the massage only on the flow of the channel. So then you will UB47, you come like that. Okay. Then you do go down, come round the ankle, and then down below, and then come to UB67. Do it, and at the end, you just press it and leave it. Okay, this is how you have to do the massage. There is, for when I say 40 to 67, doesn't mean that you want to go up and down. 40, from 40 come down straight. Okay. Right, I think that is what I can share with you today. Very important channel. So remember all the points, and even sinusitis. They're all EB. It starts from EB1, where it starts paining. So sinusitis. So what is the point to give? 65. UB 65. Give for sinusitis. It will work very well. Okay. Right? I think that's all what I wanted to share with you. And I can what I said, normal delivery, hair fall, piles, and the kidney stones. Okay. Right, I think we will close this session for now, and it is open for questions.
I request someone to give the brief of this session, please. Please raise your hand only for the briefing. Thank you.
What is this? Please guide us why the colors of the mole in our body is black in younger age and red as we grow older. Color is black mainly because of black means water. Growing red, maybe, I don't know. I don't know why it is changing color.
Ujla ma'am, you are ready for synopsis of this session? Please switch on your video. Ujla ma'am. Once again, switch on your video, please. Ujla ma'am.
Yes, sir. Madam, I want to ask a question.
Before questions, we just want a brief of this session from any one of you.
Okay.
So please wait for questions.
Okay, madam. Thank you.
Fine. Anybody else? Pallavi ma'am, are you ready for briefing? Please unmute yourself.
So for today's synopsis, we have discussed about urinary bladder channel, the UB channel, which is the longest channel in our body, having 67 points, and it originates from the corner of our eye. So basically, and ends at the little toe on the outer side, just 0.5 chun away from the toe, from the top of the toe.
Little toe.
From the little toe
Yeah.
on the end of the toe. And when we speak about a urinary bladder, it is very important. It is basically supposed to be a channel with which has to be hot, but due to lot of intake of water, unnecessary intake of water, there is coldness which comes into the channel and can cause lot of disease or pains, which we start feeling. So, for example, now there are five main points, which are the air point, which is UB67. We have the water point, which is UB66, which is wood point is UB65, and we have fire, which is UB60, and we have the last earth point, which is UB40. Now, each of this point has its importance. And while we talk of their importance, I mean, I'm trying to just give a little synopsis. So UB67 is generally, as Sir mentioned, is very good for having normal delivery. So if we press this point when there is difficulty in delivery, it will help the person to deliver.
No, not during difficulty in delivery. You should start pressing this point from the 8th month onwards.
Sorry, from the 8th month of delivery.
Yeah.
And sorry, sir, thank you.
8 months of pregnancy. Yeah.
Yes, 8th month of pregnancy. And as Sir explained, there are various reasons for the person to feel nauseatic. As he mentioned that if we vomit in the first 3 months, if there's a feeling of vomiting or person vomits, it's due to the sourness, the feeling of sourness. When we feel we want to eat sour or sour, that is because that's what that organ like liver gets cleansed. So sourness is related to liver, and it is a sign of getting that particular organ or channel cleansed. Similarly, like he mentioned heart, so, and you mentioned, so in case you're eating sweet or spicy, it is the relevant channel which is getting cleansed, and it's a good sign.
Not only channel, the organ.
The organ. Yeah, the organ is getting cleansed and the toxins are getting cleared. So it's a very good sign to have that thing, and we should eat what we feel during those months. Also, if there is fluid or water in lungs, UB67 can be used for this particular problem. If there's, I think, sir, is it fibrosis in the lungs that we talk about? Fibrosis in the lungs for UB67 can be used. Fibrosis of lungs. That is
Yeah,
water accumulation,
yeah, anything to do with the lung also.
lungs,
Fibroids, it is better UB65. Okay,
UB65,
yeah, but for any water accumulation in the lung and other things,
water accumulations. Yeah. Then we come to UB66, which is a honorary point
horary,
and honorary
horary,
point,
not horary point. Okay, HORA,
HONORARY.
not N, there is no N. HOR.
RARY, honorary point. Sorry, sir.
It's
And
okay.
it's
It's okay.
being a water point, it's located on the lateral end of the little toe and the junction of that skin differentiation. And this is mainly most of the time used for obesity. So if we use this point during obesity, it would work better because there's a lot of accumulation of water. And therefore, using this point would help the person. UB65 being a wood point is very good for any urinary tract infection or sinusitis. They are supposed to be the best points for both of this, or any infection related to eye or pain in the back or calf muscles, blockages or swelling in the ankle or the lower part of the legs. This is supposed to be excellent point for all these problems. UB60 is a fire point, and there is so this can be used during numbness, and it's a good point for hair fall. Hair fall again because there's a lot of heat, coldness, heat which is accumulated, and we need to there's a
So,
lot of coldness,
chillness.
and therefore to
Yeah.
give fire
Yeah.
we should give this point.
Why the hair is falling?
A lot
Because
of heat in the
chill.
stomach also, sir, guts, and the thing is
No.
going upwards.
No, not of heat. There's a lot of chillness.
Chillness in the
Yeah. So the channel, it wants heat. That is why your hair is falling. Because it is directly absorbing the heat.
yes. So I reverse it. So due to extreme chillness in the channel, we have hair fall, and to give it heat, it will help for the hair fall. So it will stop hair fall. It's a good point also for ankles and sprains, and good if you use these points during those problems. UB40 is again used for any problem in the lower part of the knee, from knee to the lower part, means below the knee. This would be a very good point, and it is located behind the knee in the center, on the crease of the backside, on the crease in the center, and very useful for prostate enlargement. So people with prostate enlargement should use this point. Also, sir mentioned about special points like UB56, which is very good for piles, hemorrhoids. So by just pressing these points, which are located on the center of the calf, it would help to cure those problems. UB23 is another important point for kidney stones. People having kidney stones, by pressing on this point regularly, we can have the stones, we can remove the stones. And sir definitely gave a very good example in Malaysia that he had done. So these are very good points, and the channel is located 1.5 chun. The first line goes from 1.5 chun from the center, that is the governing vessel, and 3 chun, the second line runs 3 chun away from the center line, that is the governing vessel. And UB40 and UB27 gives very good effect. So I think, and the massage, when we massage our back, all the back shoe points that sir mentioned about, sorry I missed out on this, all the back shoes points starts from UB13. So from the center of the bone where we bend our neck, we start using it. They are 1 chun apart till UB27. And UB13, 14, 15, which belongs to heart, lungs, and brain, heart, brain, and lungs, and pericardium, and then followed by GB, liver, and then followed by 15, 16, 17.
After liver, it is gallbladder. After
Liver,
gallbladder, yeah, gallbladder, it is spleen.
spleen and stomach.
spleen and
And-
stomach.
Yeah.
And then in between triple water warmer will come. You have to really
Yes.
go through it. You can't
The
remember.
last is UB23, which is the main point where we were talking about.
Yeah, kidney.
So pressing, so pressing that would help
It
in
is actually with the hip, no? The hip.
at the hip joint.
Just
The
behind-
line
yeah,
from
the
where
hip
we
line.
bend, sir.
Yeah.
From where we bend at that.
Yeah. That's true.
So that actually helps a lot. And
Or
massaging
see,
the
actually
channel-
for gallbladder and UB kidney stones, this back shoe points can be used. Okay.
Yes, sir. And massaging these points in the direction of the flow of the channel helps you better rather than massaging it in the opposite side. So always massage it from top to the bottom as per the flow of the channel. And massaging the bottom from UB40 towards UB67 would give an ideal and a very good effect to the body. I think this is what.
Okay, good. Well, it's a
Thank
long thing. Lot of things to remember. It is quite difficult, but it's good. You've done a good job. Thank you.
Thank you.
I appreciate you, Pallavi Mehta ma'am, for coming ahead and giving the synopsis or the brief of this session. Thank you so much. Now, I request everyone to raise your hands for asking your doubts, please. And please remember, only those who switch on their videos will be given access to speak. So please switch on your videos. Ujjwala ma'am, please switch on your video. Ravindranatha sir.
Namaskar.
Namaskar.
Sir, actually, for obesity, you told last time kidney K10 is good. And this time you tell UB65. Then
66.
No, 66. In that case, both are available, K10 and this one UB66. So whichever pain point only you have to do, or what actually? Obesity actually no
Yeah,
pain.
see, whichever pains more, you can apply that. Whichever pains more.
But obesity also pain will come or what?
Yeah, the point will pain.
Uh-huh.
Point will pain. Especially people with MBBS, I said, no, big bumps, big buttocks. For them, UB66 will be good.
But for men, that stomach, this one obesity will be there, For men, that stomach obesity, that one, like that,
That is different. Actually,
so you are telling overall
actually,
obesity only it will help. Huh?
Overall, yeah. But when you say for men stomach, the upper portion in your stomach, the upper portion is bulgy. Okay? If the upper portion is bulgy, then it is due to stomach, earth. If the middle portion is bulgy, then it is due to fire. If the lower portion is bulgy, then it is due to air. So with that water combine, and then you can give according.
So if you are not having idea, all 3 points you can try. So, because we don't know whether it is.
First thing I tell you, all the 361 points you press, then you will become all right. How can it? Because you have to think. Your thought works more than your points. Remember.
I think middle portion only normally it will be this one, most of the men.
Yeah.
Middle portion.
It will start from up.
But
right
it's
from,
like a gradual.
yeah. When it is starting here, middle portion is fairly quite rare. But it starts from up, goes like that.
That
Sir,
is
again,
the peer type.
Please repeat the 3 portions and its effectiveness or whatever is related to it, sir.
The stomach enlargement, that is what we call it as In Tamil, tondi. In tondi means it is stomach, big stomach. So when it starts right at the sternum, then goes down, that means the problem is with earth. When it may not start there, but it will be right only in the middle. Then it is fire. Then when it is lower, actually I have seen people, the lower, that is the lower abdomen, it will go even up to halfway down the leg. It will be like that. I've seen, I have seen a lady, and she came to me for treatment. So I was really surprised. It is almost touching the knee, the lower abdomen, just for so flappy. So it can happen that way also. That means it is large intestine. So it is air. So that is where the swelling or where the inflammation is. Okay?
Okay.
Right.
I again request everyone to please switch on your videos. Yes, ma'am. Unmute yourself. Please talk, ma'am.
Namaskaram, sir.
Namaskaram.
Sir, generally we feel very hot.
Huh?
Generally in now summer days, and it's very hot.
Very hot.
Yeah, and this hair fall also is more. So what we should, what is the reason for that UB channel or stomach it?
No. It is UB channel. It is UB channel.
So,
it is hot.
okay.
Maybe
Yeah.
hot. It is different. It is hot. But when it is hot, there is a lot of chillness. There is a lot of chillness going in. So you start
Okay.
gulping water. So the channel gets chilled further.
Okay. So
Okay.
that's why, sir, nowadays I'm not drinking water, I'm drinking buttermilk.
Good.
As
Buttermilk.
per acupuncture therapy, buttermilk
Yeah.
only.
Yeah. Good. Good.
But then also my hair day by day, now, especially in this month, I observed a lot of hair fall.
A lot of hair fall.
Yeah.
Okay. It can be due to some other reasons also. Some other reasons. But best thing is don't allow water to accumulate in your head. Wipe out. Best thing is wipe out. Use wipe your head often.
Okay,
so
okay.
there is no water stagnation there. Again, it chills now. So use something used to dry your hair.
Okay.
Keep it without water. Then, as I told you, take a lot of pepper, ginger, all spices. You can take more. Try UB60.
Okay. But sir, if I take a paper, I get more heat. Means I feel something different, like a hotness in the body.
The hotness is not because of pepper. Okay, suppose you have dosa pan, right? When you put water on the dosa pan, it's already hot. What is happening? The steam is coming. The steam is coming. It is that steam which is really you feel you are hot. Okay. So there is no this thing. It is water which is evaporating. So you feel hot. You don't worry about it. Just leave it slowly. Then it will balance. Because of water only, all these problems are happening. So take a lot of ghee. Ghee is very good. Take a lot of ghee. And then you take, as I told you, pepper.
Nowadays, I increased from when I joined to you. I increased ghee also and this buttermilk also. But due to the hotness, I feel very hot. So I decrease the quantity of this pepper.
Okay,
so now, as per your instruction, again I will be continue the same.
Yeah, you continue. Take a lot of ghee. Don't reduce pepper. Increase ghee. Increase ghee.
But sir, if I take a ghee also, no, sometime I feel that this cup is stuck to up to throat. It's stuck to throat only. It's not coming out in spite of saline, gargle, and that punjal also. It's not coming out. I feel that it is here only.
On the throat.
So
So like,
some.
like what I have. Even I have the problem. So it is there on the throat only, but it won't be on the chest. It will be only on the throat. So do
Yeah.
do lot of gargling. Gargling with
Saline
some
gargle.
saline gargle. Do that.
Nowadays, throat also is spinning. So somebody says
you
that
can
it's a deficiency of the spleen and stomach. So it's there.
No,
Spleen deficiency.
throat is always water. Throat is not spleen. Throat is always water. So
Okay.
so you
Okay,
can
sir.
you can do a lot of gargling and other things you can do. And the best thing is actually there is one vagus nerve.
Hmm.
When you clean your ears, do you get a cough?
No.
Are you cleaning your ears?
Yeah.
Okay. Sometimes people will get, my problem is that I have a vagus nerve problem. So when I clean the ears, I get a cough. So that is getting disturbed. That is why it is. That's why it is.
Okay, sir. Thank you.
Okay.
Thanks for the guidance, valuable guidance.
Right. Welcome.
Deepti Sharma. Yeah. Unmute.
So I just still want a clarity on two things. One is the hair fall thing that we mentioned. It's even if I don't have, I consume only 1.5 liters of water the whole day, and yet there is so much of
Don't
heat in the body.
quantify water. I say I drink 0.5 liters, I drink 1.5 liters, I drink 7 liters. No. Drink water only when you are thirsty.
Yeah,
Don't
sir. So,
quantify. Don't
so my
quantify.
question here is, even if there is a quantity is minimal and not as per WHO.
No. This is not the question of minimal or maximum. It is a question of that I am thirsty. I am sipping water. The water doesn't travel beyond my esophagus. Doesn't go to the stomach. That is the main idea. That is the main idea. Don't ever
So
say,
my question is related to, however, the heat. So hair fall, whenever we've studied so far in TCM, they're mentioning that hair fall is because of stomach heat. Now, and because of that stomach heat, we are saying that, okay, because at the end of the day, UB channel is mother of liver, and indirectly or directly, we are saying that there is a coldness in UB, so there's a coldness in liver. And if there's a coldness in liver, then it should actually affect many other things. And by virtue of this role, we are saying that UB channel becomes cold if we're drinking more water, but that's not the case. So we are a little confused on whether it's because of heat in the stomach that we have a hair loss, or is it because of this?
yet
Because
stomach is what?
stomach is young.
No. Which energy?
Which energy? Earth,
Earth energy. UV is which energy?
coldness,
Which energy?
water,
So which controls water?
earth.
Earth controls water. So
Yeah.
these two things, are they not connected? Even if you feel stomach is producing the heat.
So that is what we are saying. So if you're
Even if you feel so, I'm not saying that what your consumption is wrong or something. I'm only telling my observation. See, my observations are not from anybody or anything. Okay, it is my own experience which I have undergone. Okay, so I feel it is the UB channel is the one which is taking care of your hair. Is earth is taking care of your hair?
So that's a local point, right?
No, which is taking care of your hair.
The
Which
UB
energy?
channel.
Which energy? Water energy.
Water
Water energy.
energy.
Yeah, water energy is only taking care of your hair. I would rather relate it to UB rather than ST. Am I not right?
So problem is not that
See,
UB is
look,
right or
look,
wrong.
look,
It's
look,
about
look.
heat or cold. So
Which
if we
one?
are saying that if there is
See,
hair
what is,
fall, should
no,
we not
you,
increase
no,
more
no,
water
listen,
rather than
to.
reducing it?
No, listen to. What is the nature? Is it of UB channel? Is it hot or cold?
Hot.
Because it is an yang channel.
Correct.
It is yang channel. So it is hot. Right? And what is happening? You just listen to my concept. What is happening? Your UB channel, which is supposed to be hot, right? It becomes chilled. Becomes chilled. What is happening? It is expanding. Energy flow is not proper. Where it is starting, where they have, especially for men, male petal baldness, it starts from here. Starts from here. Right? Why it is going there? Because look at the UB channel, how it is traveling. Right? It is all my teachings are all from observations, not from so and so says this, so and so says this. Right?
Yes.
It is all
Yeah.
from observation. It is all my own personal experience, seeing, looking into patients. Because let me tell you how I learned all these things after seeing each and every patient. Unlike most of the acupuncture practitioners, I spend about half an hour, almost with some patients even 1 hour. People used to curse me. Array, this fellow is taking so much of time. Because their usual practice, they take the read the nadi and then they touch a point, go. I'm not like that. I used to discuss with people what exactly their problems are and how they are doing it. And then I analyze it. I make notes. I used to make notes after seeing each and every patient. Right? That is how what I do. That is how I have observed and I have come to this kind of a conclusion. Not by any scriptures or anything like that. And
Yes, sir.
another one is, I believe in God. So he gives me certain insights into certain. So okay, you tell me how people arrived at this point. They say yeah, LU10 is this. How do you know? How did they come to know LU10 is this? How it happened?
Through the touching.
No, through the touching means. But how did it happen? How did they know this is LU10? Or some name they had given earlier. Then they changed the names. This is LU10. This is LU11. Or is it written there, LU9? LU10? How? How did acupuncture himself? How was it born? How was it born? You tell me. They talk about chi energy is coming in. You touch this, you get cured, or you needle this, or whatever it is. How it is born? Because they are done by Siddhas. Siddhas are the people who can get inside your body. Even you have the capability. But all our these things are, we depend more on outside. We are not gone in. If you start going in, if you start thinking slowly, these things will come to you. They will come to you automatically. That is where I told you that I believe in God.
Yes.
I believe in God because He is the one who is giving me these points. And I found they didn't go wrong. Because some XYZ said this, I will not believe. I have to experience. You can buy anything in this world, but experience you have to undergo. From 2009 onwards, I have been practicing acupuncture, or now changed to acupuncture. Why? Why did I change to acupuncture? Because of the ill effects of the methodology of administration in acupuncture. Whether it is a needle or a touch or this, there are a lot of out this bad energy you take in, you absorb. Because energy game is a very, very risky game.
Yeah.
Even thoughts also. That is why I used to say, don't charge. If you are charging for your practice, don't do it. Then you will accumulate a lot of karma. I have seen people, my own students, dying. Even almost I also died and I came back. I touched Yama's feet. Then I came back. Then only I realized. Then somebody came and told me, because you are taking karmas. Don't do it. So I stopped. Don't collect money. That's why I'm teaching free. I'm giving treatment free. Okay. But there is no problem for money for me. I don't charge. I don't this thing, but money is there. Something somewhere it is coming. I don't know how. God is giving me. I am comfortable. I know I have drawn a line because this is enough for me. I'm getting more than that, which I donate. See, this is what is life. The belief in God is very important. That is why all these energy games, all this energy, you see, you are using electricity, right? That is energy. But can you see electricity? You can't.
No.
Can you see the points? You can't. But you believe. It is your, because why you say, trust me, it's becoming all right. It is your experience. Doing this happens. Spread the thought. That is what I am doing. So you believe. Actually, basic is not that everybody, whatever they say is wrong. It is their experience. But have your own experience.
Yes, sir.
Agreed?
Thank you, sir. Yeah.
Yes, welcome. Right. Yes.
Namaskar, sir.
Namaskar.
Sir,
I forgot your name. What is
Shivani, sir.
Shivani? Yeah.
Yes, sir, Shiva.
Yeah. Tell me.
Sir, you said that UB channel starts from I corner. It means
Inside eye corner. Yeah.
inside I corner. It means any problem in eye. Can we relate with UB?
Any water problem in eye?
Yes, sir. Water problem means without any issue means some
Glaucoma.
picture. No, sir. Glaucoma, not glaucoma. Water comes in eye. About सुनने से देखने से छोटा सा issue, not large weeping issue or other thing, especially in men.
Yeah. If you suppose, even if you think of God, water also comes in eyes.
Yes.
Yes. Water. So where it is related to? Is it related to UB? Water channel?
UB. Yes, sir.
Not related. It
Not
is related to your liver.
Oh.
Your Atma is there in your liver. Okay. Your chi energy is there in your kidney, but your Atma is there in your liver. Okay, remember that. That is why eyes.
But sir, not so much emotion involved in it.
Little bit of emotion also will do. Your water eye this one will got.
But when it starts from the age of 27 or 30,
Yeah,
not
that is you
not
are thinking
that.
too much of God. you are becoming spiritual. When you become more spiritual, eyes will start watering. Think of God, you start crying. That's what you say. You start crying for God. What should
But
you
sir,
cry for?
But sir, this issue is in a man.
In men. So
Yes,
what?
sir. Not woman, in man.
Hmm.
And he about a little think about
Soft heart.
any issue,
Yeah.
thought, or any movie. There's
Yeah.
no matter of water, but comes in eye after that.
Yeah. Right. You get involved in it. No?
That means it is not a problem.
Not a problem. It is good. Actually, he is very good material for very good spiritual material. You can get into spirituality very fast.
Okay, it's an elimination. Can we say, na?
Hmm?
It's elimination.
Yeah, it is. eliminate, because what will happen is your Atma is in liver, so it is getting cleansed. That is why the water comes. Your Atma is getting purified. More and more you weep for God, you will reach God. Weeping for God is good.
Sir, but he is not a spiritual man.
Maybe, but he will turn one day. Because he is soft hearted. People who are soft hearted, but he is a good man. Is he a good man? Or is he a bad man?
No, sir, good man.
Good man. So good and God are synonymous. So he will turn to God one day first.
But he show a little harder.
Huh?
Show him little harder. Show him harder. That he is not soft. He's so
Outside it
hard.
may be. But water
Yes.
is coming means that is what it is. Inside, outside. Actually, Hitler, Hitler is supposed to be a cruel person. But inside is a very fearful person. Outside they might show, but inside.
Yes, no problem.
Okay, Shivan. Right.
Okay.
Right.
Namaste, sir, once again.
Yeah, please.
So actually, my aunt, she has been just diagnosed with two major, one minor stone and one major stone. Major stone in the right kidney and minor in the left, and one major stone in the ureter. And yes, so she's finding a lot of pain. So I have been following TCM and giving those points. Little relief, but I give her Rajma points on the correspondence, kidney correspondence. But what can we do? Like, I mean, as you said, should I keep
23.
pressing 23?
Put her, ask her to
Lie
on
on her
her stomach, and then you
Yes.
start. Because you said right kidney has got a bigger stone.
Both kidney stones are there, but the right has a major stone.
So
Major
her
calcium.
right side K23 point will pain more than the left. You can visual, you can
Yes,
visual, you
yes.
can feel it. You
Yeah,
can
I
feel it.
felt it. Paining.
Yeah,
The right side.
will be pain more. Just
Yes.
go on relaxing, go on giving that point. Just take your
So clockwise,
thumb, clockwise, anti-clockwise. Just
Okay.
go on giving a massage, and then probably you can do it with a little bit of camphor dissolved in mustard oil. Can also do that.
Camphor dissolved in mustard oil.
5% camphor in mustard oil. Don't heat it. Don't warm it. I mean, boil it. Just warm it, and then you just give that. Because why mustard oil? Means a massage. So when you do that, that energy will work out. It will come out without any problem.
Going through a lot of pain. So now while sitting also she gets pain.
Yeah.
On the right side.
Yeah, you'll not be able to sit properly. A lot of pain will be there. But you
So
do this.
So that camphor cubes, what we get, the small ones.
Yeah, or what you use it in your cooking.
Okay.
You can do that.
Okay, sir.
Yeah.
Okay, sir. Thank you so much.
Welcome.
Ramashri ma'am, please unmute.
Good evening, sir.
Good evening.
Sir, UB 56 is in the middle of cough, no, sir? UB 656.
56, yeah. Middle of the cough.
Then in the middle of knee, backside of a knee, it's a 54, no, sir? How come it's 40, sir?
Because it's going up and coming.
Okay.
See, that is where it is coming into. Okay, I think I will show you the. I'm not sharing now. Are you able to see the picture?
No, sir. No, sir.
No, it's not coming.
Screen share not done, sir.
Screen share not done. Screen share is not coming now.
Yes, sir, come.
Okay. This is UB40, right?
Yes.
Okay. Here, it is coming this way. Okay. Coming here. First, it comes here. And see, this is UB40. Okay. But then 41 will start here. 41 starts here. You understand? Okay. Starts here, then it comes down. Then it comes down. It goes like this. All the MBBS are all there. Then it comes down. Okay, it comes down like this. Again here. Okay. So this is 50. I think this should be 53, 50. No, 54, 55. This is 56. Understand?
Where is 54, sir?
This should be 54. It is going up and again coming down, no? Or if you want to look into that. No, they are not given this on this. Yeah, you can see here 48. Okay, 52.
So in the top, you have a plus sign here, no? Over here. You can press it, and I think you can increase the size of it.
Which one I should press?
Here, sir, top. There is a zoom in and zoom out here in the top of this PDF.
Where? This only stop share is there.
Your mouse, move your mouse to your left, to the left, above. In the
Oh, here.
yeah.
Yeah, thank you.
Welcome, sir.
Thank you. Okay, you can see here. This is 41. So will be 40. This is 41. 42. Okay, you be 50, 51, 52. Like that, it comes down, right? So it comes down here. They are not given this. Then it comes to UB 54. Okay. Then it comes down. The picture is not there. So that will come to 56. 56 will be middle. Okay, you understand why the from 40 how it became to 56.
Yes.
Yes, understood.
Yes, sir.
Okay. Anyway,
And for
anyway.
UB6, sir,
Yeah.
UB66, we can use pepper, no, sir, for obesity.
UB, yeah. Finish
UB66.
paper anyway. Yeah. Okay. Right?
Okay, sir. Thank you.
Yes.
Purnima ma'am, please unmute. Yeah.
Yes, sir.
Yes.
Good evening, sir.
Good evening, ma'am.
My problem is I sweat profusely, sir. Profusely means just can't imagine, like when I go for walk and come back, like every time, and even at home also while cooking or something. Now I'm sitting with AC, so I'm not sweating. Otherwise, throughout the day I'm sweating, sir. Why is it so? And similarly, I have to keep drinking water also.
Ah. If you are sweating, not necessary that you should drink water. Sweating
But I'm
is
feeling
because
thirsty. I'm feeling thirsty.
you are feeling
Yes,
thirsty because lot of water is getting out.
Yes,
Okay. So sweating is which element?
Heat, fire.
Fire, right? You understood?
Yes, sir.
The sweating
Yes,
is
sir.
fire. So
Fire.
that means your fire is weak.
Okay.
Okay.
I was thinking the
Suppose
other
for
way.
people,
It is more.
suppose for people, suppose you overeat, you will be sweating. Will you
Okay.
be sweating? When you overeat, you will be sweating for digestion because more of fire energy is required. The heart, has to pump. Best thing for you is take 2 tomatoes
Okay, sir.
along with your breakfast.
Okay.
Take full tomato, put it in hot water, boil it. Okay, just boil it. Remove the skin, and if you want, you can add some pepper or something. You start taking it.
Yes, sir.
Then your fire, and take lot of bittersweet things. Bittersweet.
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 Like
Bittersweet.
plantain flour.
Plantain
That-
flour. Yeah.
Plantain flour that I like, sir.
Yeah.
I take quite.
You
And
will
I
like
make
bittersweet.
vegetable.
Yeah.
I'll make vegetable with bitter gourd and pumpkin.
Yeah, that you can do. Instead of bitter gourd, bittersweet is okay. Suppose if you add taking bitter gourd, add little bit of sweet. You can either in the
So that's why that pumpkin. That's
Yeah,
why the pumpkin. It is sweetish nature. So
Yeah.
that taste I like it, sir.
Yeah. So you like
Maybe
all
because-
bitter gourd because
Yeah.
you are wanting the fire. This your fire is low.
Okay.
That is why you are
Okay.
sweating more. Increase your fire this thing, then you will become all. Take tomatoes.
And sir, tomatoes I'll take, sir. And
Take anything
this in the water, can we add jeera, bay leaf, or anything to make it not to drink plain water? Instead of taking plain water,
Don't drink plain water. You
Yeah.
take it, you convert, add something to water, so it becomes food.
can we add this soft, that is fennel seed or jeera?
Yeah, jeera
or
water is good. It's good for digestion. You can do
just
that.
soaking in the water and we can drink, sir?
Yeah.
No need to boil and keep. No, sir, because here temperature is
boil it
horrible.
also. You can
Can't
boil it.
we can't think of drinking normal water, sir. Throughout the day we are with fridge water. It's terrible. It is humidity is excessive.
It's okay, but take a lot of buttermilk. Buttermilk and
Buttermilk.
Fruit juice.
Fruit
Pomegranate. Anything red is good for you.
Okay.
Pomegranate.
Pomegranate, sir.
Yeah. Take
I'm
pomegranate.
taking a lot of this
Beetroot.
one.
Beetroot.
Wax apple. Wax apple, we know, sir. Wax apple. That it is full of water content. Like it hardly any fiber. It is full of that green or white fruits. Water wax apple, they say. So that I'm taking a lot because it contains lot of water.
Okay.
It's
Take
a
it.
juice.
No problem. Any fruit.
Pomegranate and beetroot. Yes, sir.
Beetroot. Anything red you take.
Red fruit. Yes, sir. Right. Thank you very much, sir. Thank you so much.
Okay.
Namaste, sir.
Namaste.
Sir, today I was busy with my daughter. I missed a few points here and there, but had a questions related to UB21. Sir, if someone is going through a issue of maybe gastric or the lining, gut lining, leaky gut is the problem, can we use UB21 or we will use the UB27? UB21 can we use for the gut lining issue?
Gut lining issue,
Leaky gut.
leaky gut.
When that when the gut lining is damaged based on the colonoscopy data.
UB21 at the back.
Hmm.
UB21 is what?
It is a stomach related point, no, sir? Because what we were talking, UB stomach is the earth for energy. UB is the water energy from the mother perspective.
Yes.
It's back shoe point of stomach.
21 is back shoe point. No?
Yes, sir.
Sometimes I don't remember the back shoe points also. I have to refer. Yeah, back shoe point of the stomach. But this is mainly to identify the problem.
Okay.
Can cure, I don't say no. But this is mainly the back shoe points are all there to identify the problem. May not be that useful for repairing.
Okay, okay.
Okay. Suppose you have a stomach problem, you have this one to gut problem, then best point will be in stomach ST43.
Okay.
ST43.
The
Okay.
lot, so that there is a damage to the lining.
Damage to the line.
Small
Yeah. So it is wood and air. So
Hmm.
best thing is use this, or you can even look for GB34. So you see whichever is paining more, that point you can.
Okay. So last question. Sir, UB67 for the normal delivery that you were suggesting.
Yeah.
Sir, for pregnancy, for conceiving, because water elements plays an important role for conception.
Yeah.
Is there any point would you suggest for conceiving?
For conceiving. Yeah. Just one second.
Sure, sir.
Okay. So for conceiving, see, it depends on so many things.
Exactly.
So, yeah, because you should know how is the ovary health, whether the ovary is fine or whether the sperm is good. There's a sperm there, any asthospermia, all these things are there. I would suggest one simple thing is take buttermilk and jaggery water. For Ramanavami, they give this buttermilk and jaggery water. You take jaggery water first, then you take. Do this 100 ml. Do it for about 48 days. Then there is a good possibility of conceiving. Because Ramanavami, Rama, Dasaratha didn't have children. So they had some. So they said some Bhuta came and gave some paisa and all. But Ramanavami Prasadam is they give jaggery water and buttermilk. Because if you pour jaggery water and buttermilk to a plant, even during unseasonal time, it will start flowering. That is how they related to that. You can try that. That is how. Otherwise, you have to look in for so many aspects.
For jaggery water, how much jaggery to water?
Panakam, they call it panakam. Panak. You ask somebody who is making this jaggery water, panak.
Not
so they will
much
be able
required.
Sir.
For
Thank
one
you.
glass of water, you can take max of 2 or 2.5 spoons of jaggery.
Okay. Thank you so much.
Some ilachi, some sunti. That's generally added for panakam.
Okay.
Yeah.
That dried ginger sunti you were talking about.
Yeah, dry ginger you can add. You can add some karpur, this, that, for taste and all.
Food karpur we can add. That too, I think a small pinch, even less than small pinch, because it's very strong. Food karpur is very strong.
Thank you so much.
Okay, welcome.
Hello, sir.
Hello, who is this?
Oh, Fadwa.
Hmm?
Fadwa,
Padua.
how are
Yeah,
you?
yeah, good. Yeah, tell me.
I want to ask about 2 or 3 things. The first one, the UB67 will be, how can I say it? Is it useful also for test OPECA and all gynec problems, or only for normal delivery?
No. Can use it for gynec problems also. Any other gynec
Mhm.
problem also, but it is mainly used for normal delivery. See,
Okay.
what happens? The pushing of the child, the unborn child, through the vagina, it has to
Yeah.
happen. You have to push, you have to put pressure, right?
Air.
Yes. So for which, suppose you are passing stools, you are applying pressure, isn't it? From where does
Yes,
the pressure
of
comes?
course.
It comes from the lungs.
The lung. Yes.
Yeah, air pressure. So
Mhm.
same thing, uterus is water and the pressure to be given is by air. So you give the
Mm.
air energy plus this, so that there will be a normal delivery will be normal. Generally what happens is, because we make the uterus weak by consuming a lot of medicines. For example,
Yeah.
they say you take calcium tablets. Okay, but calcium will not be absorbed.
Yes.
So the uterus wall becomes weak. It is the magnesium which has to become calcium. Not calcium will never be absorbed. So likewise, with taking a lot of medicines and that and this, that makes the uterus wall weak. So to help that normal delivery, you have this, you apply this UB67 or any air related problem in the uterus, or in the gynec problem, in the gynec parts, any air related problems, you can do that. You can give UB67, but mostly it is used for normal delivery. But
Yes.
otherwise, what kind of a problem you can think in gynec? Usually an infection, or it might be fibroids. They're all again water only.
Means UB66.
You see, UB65.
5 is wood.
Yeah, wood can clear all the fibroids.
Mm.
Okay, fibroids are mainly because of wood and water.
Okay. Thank you. The other question is, you were speaking with one of the person, and you say glaucoma. Is
Yeah.
UB channel has something to do with glaucoma?
Yeah, very much. UV channel,
Uh,
where does it start? It starts from the inside of the eye,
yeah.
inner eyeball. Okay.
Uh-huh.
So water, it is water.
Yes.
And glaucoma is what? With your eyeballs, they get filled with water. And there is a small hole is there, where
Yes.
your eyes, they become there. Completely they are flushed with water. So that also gets blocked. Okay.
Mm-hmm.
So UB65, when you give, so that will get released. Sinusitis, glaucoma. It will have a fantastic effect. See,
Okay.
in eye, around the eye, you have UV
Mhm.
here, you have UB here, you have ST here starting.
Yeah, 1
Yeah.
and 2, yeah.
Yeah, one in the
Mm.
then you have
Mm.
GB here.
Yes.
So all these 3 points with their wood effect, it'll get the infection or anything to clear off your eyes. But UB point, UB65 is also good.
I
ST,
have UB2, who is paining
yeah,
in
UB2.
both eyes.
Yeah, your water content is very high.
Yeah, I know.
looking at you, I can tell you. So
Yeah,
reduce water.
yeah, I am
Reduce
reducing water,
Yeah.
but
So
still,
yeah,
every time I am massaging it
yeah.
because it's really paining.
Yeah, you use UB66 also.
UB66.
There is water,
Yeah,
water.
UB66 and K10.
65 also you can use.
65. Okay. Thank
Use
you.
Use a lot
Thank
of
you.
water.
Thank
Welcome.
you.
Welcome.
Namaste, sir.
Yeah.
Hi, Mushaida. Namaste, sir. Actually, we are lucky to be part of this class. Every time we'll get one or the other knowledge. After completing the course, actual knowledge is coming through your class, sir. This one, my doubt is uterus prolapse, is urinary bladder prolapse. There are two things. Bladder prolapse means normally organs, holding the organs is a spleen function. Here we have to take the earth point of the UB for bladder prolapse.
Whichever is not in its position.
Yes, sir.
Any organ which is not in its position, it is the earth which is involved.
Yes,
so
yes.
UB40. That's all.
UB40, UB40. Yeah. Okay. In retention of urine also happens in few peoples. Bowel is not completely evacuated. Some amount of urine will be retained.
You can use
that
either
time
air, either you can use air
or
air,
wood.
air
Sorry.
or, yeah, air or wood. Yes.
Okay. In aged people, the inconsistency of urine happens. That time UB40 only, no, sir?
Yeah, UB40.
Okay.
UB40.
Thank you, sir. You have told UB67 for my daughter-in-law when I stayed in US. It helped me, sir.
Yeah.
She did the normal delivery.
Yeah.
Very grateful to you, sir. Thank you, sir.
What is it? Be grateful to God. That is
No,
all.
no. We are learning so much through this class.
Yeah, through this class, you are learning because you love God. That's all.
Thank you, sir. Thank you. And
welcome. Yes, sir. Back again. What is the problem now?
During your all discussion, I got to this one. One with Shivani, she was telling, men they will get whenever they become the emotional like that.
Yeah.
Particularly my thing, what is happening? I think last 3-4 years. I used to laugh when ladies they used to see any movie that one they used to cry,
Yeah.
I used to laugh. But now it is happened to me also now.
Yeah.
So now what happened whenever I'm particularly Sanskrit shlokas, they were this God shlokas. If I hear itself, I will get tears like that.
Yeah.
And even any this one moving type, this one in movies, I feel as if I am crying like that. So now I feel my wife is to tell why you are crying now for anything, even you are hearing any sound of this God, this one Sanskrit shloka like that. So, but you are telling that one something related to with the liver like that. Is it? It shows any liver energy weak or this one like that?
Not weak. Liver is getting cleansed. Liver is getting cleansed. What is the wastage of liver? Wood, tears is getting cleansed. That is why children, young children, they start till the age of 6 or anything and everything, they'll start crying. Why they are crying? Because the liver is getting cleansed. That is why they are crying. Likewise, once you become nearer to God, so your liver is getting cleansed. It becomes soft. You become soft. Totally, you are very hard. Now you have become soft.
Yes.
Because that means you are going nearer to God.
So no issue then.
Oh no, it's good. It's very good.
Because I
Even
am
if
so
I-
much
if I talk-
emotional now. That's why
If I talk more about God, tears will start
yes,
rolling
yes.
in my
That is
eyes.
a problem for me now.
Yeah, that will come.
Even sloga, if we are here also, I
Good.
feel like so much emotional.
Good.
Started crying also. Somewhere I will go and cry. Actually.
Good. It's very good. Keep it up.
I thought some liver related any energy.
No. Liver is getting cleansed. That is why your Atma is getting purity. In Tamil, they say to reach God, Aludal unnai peralame. If you cry, you can reach. That is what. That is the first stage.
And another one is actually somewhere I read, I forgot, and UB64, like that, they will, so many places they will tell, what is the significance of UB64?
64.
Yeah.
No idea.
Okay, then I will recollect it.
Yeah.
Hello.
Yes.
Namaste, sir. Good evening.
Good evening. Who are you? What is your name?
Usha.
Usha. Yeah.
Yeah. Basically, I would like to request you. I have a pain in my lower teeth. That is the second last from lower side, right side.
Lower teeth.
And that is root canal tooth.
Okay.
I have visited doctor also, and he has given me antibiotics. And he said, because at that time it was not properly diagnosed that which part of tooth is pain, either on the side by side or root canal. But since 2 days, I am observing that root canal tooth is getting pained, and that pain is aggravated during night only after almost 12 a.m. And after 2 to 3 hours of suffering, I have to take painkiller. And the doctor also said that go for all antibiotic and painkiller for 5 days. And again, he has asked me to visit his clinic, and we will go for the x-ray. And if root canal tooth is infected, then we have to remove that tooth. I don't want to remove, sir. Please help.
It all depends on how much it is affected. If it is quite affected, you have to remove. Try K3.
K3. Okay.
K3 point. K3 point. Try
Okay.
that point. Put some clove. Clove.
Okay.
Clove.
Yeah,
put it-
I understand. Yeah.
Put that. And also put a pepper in ST43.
ST43 black paper.
Yeah.
Okay.
K3. Again, put K3 and put it in
K3
ST.
kilo.
Yeah.
And
K3.
for how many hours, sir?
Which one?
How many hours?
You put it till the pain is gone. Go on giving that pressure on that pepper. Okay.
Okay.
Okay. About 30 pushes in the twice a day. Okay. And then as long as the pain is there, let it stay there. Unless and otherwise, there is some problem in the point. Okay. Then remove, change your leg and do it. So if it is on the left side, you put it in left side leg K3. Okay.
I have a right side, so
Right. Okay. Right side on your right side leg, right side inner, near the inner ankle, you put K3 over there, and then you try. Okay. And ST43 also you put.
okay. Thank you for this. And one more question, sir.
Yeah.
One of my relative, she's a lady. She's a age of 52 years. She have just started a floater in her eyes. So kindly help for this also.
Do one thing. because
Yes.
that's just like that we cannot answer. You go
Okay.
to the group consultation. So
Okay.
you answer all those questions, then we
Okay.
can find. Okay.
Okay, sir. No issue.
Okay.
Okay. Thank you so much, sir. Thank you.
Yes. Okay. Yes.
Yes, sir.
Can
Yeah.
we call it a day?
Yes, sir. It's very late for you also. You have,
Feeling hungry.
I know, sir, 2 hours of class.
Okay, no problem.
Thank you so much, sir. Good night,
Okay.
sir.
Okay,
Tomorrow,
good
11
night.
a.m. to live totally and leave totally. Okay, please join at 11 a.m. Thank you, everyone. Good night.
Good night. Thank
Happy
you.
weekend. Happy Sunday. Gratitude for the session, sir. Thank you. Bye-bye.
Bye.
Bye, everyone.
Good night, sir. Thank you.
Good night. Good night.
Thank
Bye.
you very
Thank you,
much.
sir.